All right, we're going to do some quick knot tying videos here. The first thing that we're going to go over is the two-handed tie, the most common way you're going to do that if you are right-handed. This is often a C-section for sewing fascia, sewing the uterus. So pretend you have your needle in your right hand. You throw that stitch. It ends up over on the left side. So we'll pretend that our red string is the one that has our needle on it. So we grab our string. The first thing that we do is cross it over. So, and oftentimes in a C-section, what the attending will do is even just lay it down in the field here. So you have it crossed over, and then you have your two strings that you're working with. The biggest thing to pay attention to when you're starting is whether you crossed over with your needle over the top or over the bottom. So if you crossed over with it over the top, you're going to be starting with your index fingers. You take your string without the needle on it, you pull it over here, you make a little pincer with your thumb and forefinger, go through, grab your blue string, which is the tail that doesn't have the needle on it, pull it through, and lay it down flat here. So we had just done our index finger. For these you have to alternate, so we just done our index finger. So instead we put our red string with the needle on it over our thumb. We bring the blue string over this way, form our pincer, grab the blue string through like that, and then this you're going to rotate your hands a little bit so that you have the first knot looking like that. And having the different color strings is helpful to know to be able to visually see that your knot is correct. So we just did our thumbs. Now we'll go back to our forefinger. So have the red string with the needle over our forefinger, bring the blue one over, form your pincer, pull it through, grab your blue string, tying it down flat. And it's really important to pull the equal tension on both sides. Otherwise, your knot will not lay down flat. So we just did our forefinger. Then we do our thumb now, pulling it through, kind of switching your hands with your thumb and laying it down flat. So that's what your knot should look like. I'll do a quick example of what your knot should not look like. So we're on to our forefinger now. We pull it through. If we're going down, we're going down. But if we get the wrong tension, then we're just going to pull it through, and it looks like we're just tying around one of our strings. So that should not be how it looks, but you want to be sure that you're pulling equal tension on both sides. And sometimes the attending will kind of push the knot down to make it a little bit tighter yet. So you're just alternating back and forth. We just did our forefinger, so we're alternating back and forth. We do our thumb now, bring it through, pincer grasp, and then rotate your hands. And that's what your knot should look like. Usually on the two-handed ones, you usually do about anywhere between 4 to 6 knots, and then you'll finish then. So another way to do that you may experience more at the beginning of the academic year. We'll undo this here. But let's say the attending is standing across from you. You're still right-handed, and you want to tie it the same way. But let's say the attending is standing across from you. They throw the stitch from their right to your left, and they say, okay, here, now tie this. So now your needle and your needle driver are going to be on the other side. So we have that on our blue string over here. Once again, same steps. First step is to cross it over. And you got to figure out, okay, did I cross over or under? For this one, we crossed the needle over. So we're going to be starting with our index finger again. We have our blue string, which is the one with the needle over it. We bring our red string over, form our pincer, come through, grab it, and lay it down flat like this. So we just did our index finger, so now we move to the thumb. We come here, grab it, and you rotate your hands, and your knot should lay down flat like that. Just did our thumb, so now we're back to the index finger, having it over like this. Pull the tail over, pincer, grasp, pull it through, lay it down flat. Now back to our thumb, bring it over, pincer, pull it through, rotate your hands to lay it down flat like that. So, and then you just keep doing that over. Once again, 4 to 6 knots is usually sufficient on this, and the attending will tell you when they're done with that. So.